More health news. We're nearing the end of Black Maternal Health Week, and a new study shows that Black women are at a significantly higher risk to die from pregnancy-related complications than white women. The study published earlier this month shows the rates of maternal deaths overall increased from 2018 to 2022, going up to 32.6 deaths for every 100,000 pregnancies. They were significantly higher, though, among Black women, who saw 76.9 deaths for every 100,000 pregnancies, nearly 3 times as many as white women. To talk more about this, we'd like to welcome Dr. Meredith McMullen in the studio. You are an OB-GYN at Kaiser Permanente. Thank you so much for being here.
Thank you so much for having me.
These numbers show a problem that doctors and OB-GYNs have been talking about for years. Why is it that we're having these disparities between Black women and white women?
Well, that's an excellent question. There are so many things that factor into maternal health care, and it turns out that the social determinants of health have a direct impact on a lot of these disparities. So these are all the non-medical things that impact our health care. Our economic issues, housing stability, lack of paid maternity leave. All of these things help to create the situation.
So then what can patients and doctors do to make sure they have the best possible outcome?
Well, that's also a great question. I think being on top of your own care, making sure that you're showing up for your prenatal visits, making sure that you have a comprehensive healthcare team that's there dedicated to you, that can communicate well with you and address the issues that they know that you're at risk for is really critical.
How do we teach doctors then to be more cognizant of these risks so that there isn't any kind of bias or oversight when a Black woman comes in for pregnancy-related care?
Right. So I think in healthcare we're doing a lot in terms of educating our staff and educating physicians and midwives and bringing in a comprehensive team that includes midwives and doulas even. So I think making sure that we're aware of these issues is really the first step, and then making sure that we encourage those communication gaps to disappear. We want our patients to feel heard. We want our doctors to be in positions where they can really listen and take into account the big picture with every patient.
All right, Dr. Meredith McMullen, an OB-GYN from Kaiser Permanente, thank you so much for talking about this important issue with us.
Thank you so much for having me.